Hello, 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 hello. Today we're talking about A to Z dentistry, toothache. T stands for toothache. Thank you for coming. This video is created for educational purposes. It is not intended to be a substitute for professional dental advice, treatment, and diagnosis. Always seek the advice of your dentist or other health professionals regarding your condition. The statements made through our video not to be relied on for diagnosis, treatment, or prevention, including any suggestions made. Thank you. Project goals to understand toothache, how knowledge can help, how to prevent toothache. So one may ask, what is toothache? According to the statistics, according to dentistry.co.uk, September 2023, 23 million, I repeat, 23 million sick days were lost to dental pain. People did not go to work because of toothache, and 23 million sick days were lost. This video is going to help you to prevent toothache, since I believe in prevention is better than cure. So why are x-rays important? They are there to diagnose other illnesses like caries and other tooth-related disease. For example, if you look at the picture, you can see the wisdom teeth and it tells you whether it's close to the nerve. You can see the bone level. You can see the lower right first molar has been root filled. This radiograph can show you the jaws, the upper and lower jaw, what is going on. And it also shows you the different parts of the tooth. So if you look at the lower right second molar, because if you are facing me, the picture is like you're standing in front of me. So the right second molar shows you the enamel, the dentine, and the pulp. And it also shows you the ID nerve. If the tooth is sitting on the ID nerve, it can be very painful. And also, if you look in the upper arch, the sinus is showing. Some people have got the roots of the tooth in their sinus. And at times, if you suffer from sinusitis, it can affect your teeth, which is called referred pain. You may think it's a toothache, but it could be your sinus is playing up. So another way of testing if you've got sinusitis is bend your head. If you feel heaviness and pain, or your nose is blocked, then you know you've got sinusitis and it needs to be treated, or else you may think it's toothache. So, what are the signs and symptoms of toothache? The first thing is pain. It could be a swelling, it could be a funny taste in your mouth, it could be an abscess, it could be a cracked tooth, and you feel this excruciating pain. The pain may be mild, moderate, or throbbing. You can feel very favorite. Some people end up having a temperature. And so all those are very important. Excruciating pain, that is so unbearable. I'm now going to talk about feelings because pain is subjective. One thing that may be painful to somebody may not be painful to the other person. So it's how you describe it. Some people may describe the pain as mild, another person may describe it as moderate, another person may describe it as quite severe. Or someone may describe it as throbbing or sensitive or stabbing. Just how you feel emotionally and physically. So pain can really make you feel drained. So how do you prevent toothache? You can prevent it by visiting the dentist regularly, brushing with preferably a fluoride toothpaste, spitting after brushing, flossing. You can go to your phone right now and download an NHS Food Scanner app, which tells you your phone becomes a barcode reader. It tells you how much sugar in your food. The best time to eat sweets is after meals. Share the knowledge. Thank you for listening. Prevention is always better than cure. And some of the causes of toothache will be cracked teeth, sensitive teeth, gum disease, swelling, abscesses, funny taste, broken fillings, and a cavity. How do you have a cavity? When the sugar you eat, the bacteria acts on it, produce acid which attacks the tooth. If you feel it, you don't have any problems. If you ignore it and it hits the nerves, the complications are pain, the risk pain, alternative do nothing or restore it. If you ignore it and it hits the nerve, that's when it keeps you awake and you need to have a root canal treatment. If you don't want to have a root canal treatment, then you're going to end up losing the tooth. That's extraction. The pros and cons are you need your teeth to smile, to eat, to chew, and to help you with your confidence. So the benefit of having your tooth in your mouth is very important, or else extraction, which may affect your confidence. So in order to avoid all this, practice prevention is better than cure. Thank you for listening and see you in the next video.